Hey everyone, Robert Nixon here with Dr.Graham Sigalet of Yellow Cedar Integrative Wellness. Do you want to introduce yourself?
My name's Graham. I'm a naturopathic doctor in Campbell River as well as in Courtenay. Just started practicing here in August.
So we did this with a few people. We did the profile assessment. Whoever's willing to. You get the green. The greens aren't normally willing to do it, but Graham was, and then it's going to go over it a bit. So Graham was a high blue ocean with a green planet. So the blue ocean is like what they see, makes amazing eye contact, listens attentively, facial expressions indicate warmth and friendliness, prefers soft fabrics, and to be comfortable, polite, and nurturing, makes use of touch frequently, stops work to engage those. So these are like the type of people that are caring and hugging and stuff, right, normally. And then what they hear, speaks with feeling and voice, does not use threatening language, avoids conflict, mellow, soothing voice, uses frequent I statements, will frequently apologize. So they're just some sort of things that blue oceans do. And then he was a green, which is me too, which is, they seem like they kind of maybe don't go together, but what am I? I'm a green gold. So green planet's a little more like cut and dry, always has to be right, comes off a little bit arrogant. That's my impression of it because I'm a green, and that maybe doesn't mean to, but does not show emotion easily, businesslike and serious in manner, may not appeal casual or friendly, gestures from the head, hand movements. I use hand movements quite a bit. Used to explain or show models, what they hear, ask why questions, so analytical on what people want, I think proof of why do you say that, what's real. Ask many questions, may take time to respond. I definitely do that, to actually think things through. Well, sometimes. Will respond negatively to incorrect information, points out errors, mistakes quickly, may want to improve on ideas shared in conversation. So yeah, anyways. Two totally opposite personality traits there.
Sounds like a good balance.
It probably is a good balance. Yeah, maybe I need some gold, some blue instead of like green's like get her done, gold's like checklists and analyzing everything. So we're gonna ask him a few questions about his career and stuff, and I'm kind of hoping he'll dive into it a little bit because I think naturopathic medicine is quite interesting. I've been seeing a couple naturopaths. I've been seeing Graham a little bit, but I had another naturopath I've been seeing for some time, and I just think it's interesting how you go to a doctor for stuff and they just look at, pain medications and maybe antidepressants and stuff, whereas a naturopath doctor will look at things like hormones and things that actually change in your body over time, not outside sources that aren't natural at all. So there's a lot to offer there. So first of all, how long have you been a naturopathic doctor for?
So I graduated in December of 2018.
I feel like you prefer forward.
And so this is my first year of practice.
Yeah.
At our school clinic, however, we did see patients in our third year and fourth year. So I have been seeing patients for three years now. I've been practicing under my own license now for a year.
Awesome. And he seems quite smart to me. We've talked about some things, and he definitely knows what he's doing and has some good input for sure. How would you say this industry has changed? Well, how long did you go to school for?
4 years for an undergrad, and then the medical program is 4 years. So.
Yeah, so you basically in 5 years sort of in the industry, right? Mm-hmm. And 4 years was just the bullshit they make you do to get there?
Yeah.
I don't know. I wouldn't know because I don't have that kind of schooling. How would you say this industry has changed in the last 5 years, and how do you stay ahead of it all? So, like on the medical side, how's it changed, or has it evolved since you started schooling 5 years ago?
Absolutely. I mean, There's a lot more emphasis on research now. People want to be practicing evidence-based medicine for best outcomes.
Yeah.
So there's a lot more emphasis on research. So it is difficult to stay on top of all that. There's a lot of different journals that we have access to, and then I go to conferences every year. So under our college, we also have continuing education requirements.
Nice.
So as a profession, we have to stay on top of the evolution of the medicine.
Right, which most professions in real estate the same. You gotta always be training, especially the last year and a half with all the changes. So with that said, I think me and Graham sort of had this conversation before, and it's a little different than what Tanya had here, but as a naturopath, like my thoughts on a doctor is you become a doctor, it's probably easy to find work. You may have to go outside of your town to find a job, but there's probably always going to be work there. It's easy because you got lots of schooling and there's obviously not a lot of them. Mm-hmm. Is that same with a naturopath, or do you have to go out and find it? And maybe what what are people's inputs on naturopathy? You have to teach them
Oh yeah,
to figure out what you are and come in the door.
I'd say the number one thing is education for patients as to what we do, educating the public. A lot of people think it's a little bit out there, not based in science, that we don't see the human body as the same way a medical doctor would, when in fact we do. We just have different philosophies in how we treat patients. And in terms of being a naturopathic doctor, I didn't come into it to run a business, and now I'm finding I have to balance my medical knowledge and my passion for medicine and connecting with people, as well as being an entrepreneur and going out and doing talks in the public and Facebook Lives like this. So that,
sucked him in.
So that's an interesting part of the profession for me, is trying to nurture the business side of it, which isn't natural for me. I'm more drawn to the medicine, to the connection with patients.
Yeah. So do you use social media at all currently to do any of your stuff?
I do. Yeah.
You do? Okay. So you have a business page and stuff?
I do. I have a Facebook account and an Instagram account.
Okay.
Yeah.
I should go like them then, I guess.
Mm-hmm.
So then, I mean, that's probably a good way too, because you can just share stuff and what you know, and people eventually will start to see what you do and
so I
get more clients, right?
For sure. And a big part of that is educating on what it takes to become a naturopathic doctor and some of our philosophies, and sharing research with treatments that we do.
Awesome. Probably never ending, I'm sure.
Mm-hmm. Yeah, it's exciting. It's fun.
So what did you do before becoming a naturopathic doctor, and how did you get into it?
So I finished my undergrad degree at VIU and then at UBC, which was a mix of sport, health, and physical education with kinesiology.
Okay.
I played varsity volleyball at VIU as well as UBC. And after that, I was a forest firefighter. So I spent 5 years working for the wildfire management branch of British Columbia. That was a seasonal work, so I'd be working from usually May till October, and then I'd spend the winter traveling, which was really nice.
So that was between your undergrad and doing the natural. Yeah. So did you already know you wanted to do the naturopath training, or you weren't sure yet?
I wasn't sure yet. I knew I was going to do something in health sciences. I was debating maybe physiotherapist, occupational therapist, maybe a chiropractor. But in those years traveling, I volunteered on organic farms. So I lived in Hawaii for 2 winters on an organic farm, learned a lot about nutrition, learned a lot about plant medicine there, and that seeing how powerful natural remedies could be really was quite inspiring to me. So I made the plunge for another 4-year degree and decided to go with naturopathic medicine.
Awesome. And I think something like kinesiology would even be further down the line as far as being an entrepreneur, because it's sort of in, I don't know, I look at it as things that people have to have, like a doctor, a chiropractor maybe, or a physiotherapist, maybe then a naturopath, and a kinesiologist is like not quite in there, right? So I think, like, to be a kinesiologist, I think you'd have to try harder to promote yourself and create a business out of it. I think it would be a hard thing to do.
Yeah,
for sure.
I felt like when I was doing that training, I was just skimming the surface of everything in the human body, and naturopathic medicine allows you to go deeper.
Yeah. Hard to take, and depending what you like, it's hard to take what you like and create it into a business, right?
Yeah.
For sure. Because I'd like to do something like that, but I'd never go back to school that long. It just wouldn't happen. Maybe, you never know.
Yeah.
How do you describe naturopathic medicine to someone who has never heard of it before? So I think that's a good question for sure.
Yeah, I describe it as we're trained similarly to medical doctors in terms of similar courses in anatomy, physiology, pathology. So we have a really strong foundation of medicine in the human body. People are often surprised that professors at our school are medical doctors, they're pharmacists, they're PhDs, and they're naturopaths and chiropractors.
Right, so they have more than one.
Yeah, so we have a really well-rounded medical education. What the big difference is for naturopathic doctors is that we're really focused on looking at the whole person. So that's the mental, the emotional, the physical, the spiritual as well, and really trying to get to the root cause of what's causing someone's condition. Why are you experiencing these symptoms? So we're looking at not just fixing symptoms, but really looking at true healing and root cause medicine.
Right, and not fixing the symptom, but maybe being proactive before the symptom arises. Some things, right? It's hard to do that. But
we're always promoting preventative medicine.
Yeah,
absolutely.
For sure. Stop the sickness before it's there. That's the hardest one, the colds and stuff. What makes you passionate about what you do?
Well, I love medicine. I love the human body. I love my education and now what I know about botanical medicine and acupuncture, how pharmaceutical drugs can be implemented correctly, and how how they're saving lives.
Yeah, you're not
So,
necessarily anti-pharmaceutical, just the right ones,
absolutely
right?
not. Yeah. They're people come in and their lives have been saved by that. But I love food as medicine, and I love ultimately connecting with people and helping people live a better life. And making them feel heard and their medical experience validated. Our appointments are usually a lot longer. We really get to know people, and there's a really strong connection between the patient and the doctor.
Yeah, it's interesting. I was listening to a podcast the other day, and it was Richard Roberts, which he's a real estate coaching program system, whatever. He's a huge business, but he had his doctor on there. He was interviewing, and his doctor, she's still a medical doctor, but she basically was like, in medical school, we're taught to spend a half hour with each patient. She didn't really get to know them, figure them out, and read into them. And she's like, then I got into it, and it was like 5 minutes out the door.
Yeah.
So she got out of the sort of what would you call it, like the normal practice of being a medical doctor, and started doing her own thing.
Right.
Which I think what she does now is a little more like a naturopathic approach, where they really spend some time with you and figure things out, and figure out the cause or preventing the cause before it's there, not just writing a prescription or spending 5 minutes with a patient.
Yeah,
so
absolutely.
there is doctors out there that do that for sure as well, right?
Oh yeah, lots of great doctors out there.
What would you say is your biggest accomplishment, or have you reached your biggest accomplishment yet?
I think graduating from naturopathic medical school is a really
that's huge.
big accomplishment, and also
Was it hard?
it was the hardest 4 years of my life. I definitely learned a lot about limits and stress management. Before that, I thought I was indestructible. Even firefighting, you work an 18-hour day and you recover.
It's not the same, is it? Physical or mental? It's different.
Yeah, it's a different kind of stress for sure. And totally. And also playing for the UBC Thunderbirds, I was a really serious athlete always growing up. And
what is that dumb question? But is that what sport?
Oh, volleyball.
Okay, volleyball, right?
Yeah.
Okay.
And a lot of my aunts and uncles and cousins played for the Thunderbirds, so it was nice to carry on that tradition.
Yeah.
And wasn't a star for the team or anything, but it was still a big accomplishment for me.
He's got the build. I don't got the build for volleyball. I can't spike, I don't think. What are your long-term goals? Obviously, probably have quite a few, I'd think.
Yeah, right now, I love what I do, and having a career that's fulfilling and helps people has always been my goal. So I'm living that, and I really want to be able to purchase some property where I can grow my own food and feed my family and connect with nature. So maybe you can help me out with that.
I could help you with that. I think gardening's very neat. I've never been a huge gardener. My last house had lots of garden. Like, I shouldn't say I've never been. I'm just not super passionate about it. But my parents have like a massive garden on Hornby. It's like, I don't know, it's an acre or two, the garden. I think it's like an acre. Maybe it's a half acre, but it's big. And then they got cows and pigs and
awesome.
It's cool. I definitely take advantage of the meat I can get from them and the organic vegetables and stuff. So yeah, that's a good goal. What was I going to say? I don't know. Next question. I had a different thought before that, but long-term goals. So what advice would you give someone who's interested in getting into naturopathic medicine?
As a patient, or as becoming a naturopathic doctor?
Sorry, I think that's where I was going with it. Is back to your long-term goals and stuff. So you're in Campbell River at Yellow Cedar Integrated Wellness. Yeah. So are you here? But you live in Courtenay or Cumberland. So you're here a couple days a week, or every day of the week?
3 days a week right now.
Okay, and you're taking new patients on and stuff?
Oh yeah.
Okay, so I thought that was just a good thing to talk about, because obviously you're taking new patients. You're trying to build a business in Campbell River because you've been here a shorter period of time than you've been working, right? So you're new to the community, and definitely check them out. So back to the other question. Getting into it either way, I guess, if they want to start becoming a patient or actually getting into the industry. I mean, you sound like you didn't really know until after your undergrad. Yeah. That's what you wanted to do. So it may not be something you know right away, right?
No, and I didn't feel pressure to jump into something without. I was lucky. Firefighting was something I enjoyed, provided income, and gave me space to explore the world a bit as well. But if someone's interested in becoming a patient, I'd recommend phoning the clinic and booking a free 15-minute consultation. So it's just a meet and greet that I do with patients.
Yeah.
I don't really offer medical advice, but it gives them a chance to ask questions about the trajectory of treatment and what that would look like.
Right, what you do. And they can probably email you or Facebook you or something too if they just have a quick question to maybe see where you're at. Or
Yeah, just so long as it's not providing medical advice. I've really...
Because you're not allowed until they're a patient, probably?
Well, I just want to know their whole history.
Right, yeah, of course. Yeah. So you want to spend the time with them.
And make sure we're not missing anything important or dangerous.
Yeah, and if someone's not willing to put the time into themselves, sometimes it's hard for you to put the time in, like, right? Oh, I just want an answer to this. I got a bump on my skin. I don't know.
Yeah, true.
They got to put the effort in, too, and come put the time in to talk to you, right? I would think. Because I'm the same way in my business. If someone doesn't want to come to the office and meet me, then, well, how come you want to meet me at a house? I mean, but, you know what I mean? We've never met before. So. Yeah. It's one of those things, right?
We do house calls once we've met patients, though.
So. But you want to meet them first. Yeah. What if they had an issue where they weren't able to come in, like they were disabled?
Actually, last week someone herniated their disc, and we went right to their house.
Yeah.
So I work with a chiropractor as well. So the chiropractor did the treatment first, and then I did acupuncture, and that's a really nice thing we can offer. And for cancer patients, I'll often do IVs at home.
Yeah, which that's good because some people can't, right?
Yeah.
Or they don't have the help to help them get there. What would your patients describe you do as... what would your patients describe you do as... Or parents describe you do for a living? I was reading another line at the same time.
They both proudly say that I'm a doctor, and they'd emphasize...
The doctor? Do they? It's ND or MD?
My grandpa was a medical doctor. And,
okay. So it does sort of run in the family within reason. Yeah. But they say doctor.
Yeah, they proudly say doctor. My mom more focuses on the medicine. My dad would probably say he's a small business owner as well.
Okay.
My dad's a lot more...
So are they on board with the naturopath thing? Do they use a naturopath, or are they sort of a little bit different generation that maybe isn't...
My mom was raised by a medical doctor.
Yeah.
But I started seeing a naturopath when I was 9 years old. So we would see...
Okay, so they would have had to take you there.
Yeah. So we'd see medical doctors and naturopaths. So I love both sides of it, and I love collaboration. And, it's one of the great things about working at Yellow Cedar and at the Grove in Courtney is that there's chiropractors, there's Chinese medicine doctors, naturopathic doctors. Some of my best friends are medical doctors. Yeah. So I love getting different perspectives and not thinking one way is the only way.
You don't want to be closed-minded.
Yeah,
for sure.
Putting our heads together.
Interesting. The parent question is always an interesting one for people. Because what do your parents do, if you don't mind me asking, or what did they do?
My dad is a retired lawyer.
Okay.
And my mom is a librarian at university.
And your mom's dad was a doctor.
Yeah.
Yeah. Cool.
Yeah.
Interesting. I don't pre-read these questions sometimes. Sometimes I do quickly, but you're a new addition to the crayon box.
Okay.
What color would you be and why? Oh, so this is more... Did I already go over all the practical ones? I did too, didn't I? Okay. That was quick. That felt quick anyways, maybe because I was interested. But is there anything else you want to talk about as far as your career and naturopath and stuff? I mean, sure you could go on forever. But...
Yeah, no, it's I'm really passionate about it, and I think there's a really great place for naturopathic doctors and chiropractors to fit into people's healthcare. So
yeah, for sure.
If you are struggling with something and you don't feel like you're getting answers, and if you've just been given a diagnosis and a prescription, there's ways that we can help, especially with chronic conditions, autoimmunity, digestive health. Opinion. Yeah.
And I think something I want to bring up too is something like if you have benefits, naturopaths are covered normally. It's not covered by MSP, I don't think, or maybe if you're low income or something.
Low income, yeah.
Yeah, so if you're low income, it could be, but there is a cost. But definitely worth it, right? Investing in yourself.
Absolutely. For
sure. Like they say, I mean, all the great trainers and stuff say invest in yourself to be better for your clients and stuff too, right? Or your business or your employer. Whether it's exercise or naturopath or seeing a doctor, right? Mm-hmm. So, yeah, interesting. You got any questions for him? Got anything that you're curious about? I'm trying to think if I have something. You want to know the color of crayon? Oh, okay. Anything else?
No, I think that's good.
No? Okay.
Yeah.
So
Well, I actually have a question now. You made me think
you're not allowed to talk to the camera girl now.
For those that don't know, what, so you do like IV treatments, what other,
Okay.
therapies or treatments do you provide for people?
Yes.
What is an IV treatment?
An IV treatment is a intravenous vitamin therapy, so different kinds of vitamins, usually vitamin C, B vitamins, that are put into a bag of saline or sterile water, and that's going directly into your veins. So that bypasses a lot of any digestion that needs to happen. So it's a direct infusion. To me, it's a boost for. It's not one of my first go-to treatments for people unless we're doing it for infection or cancer, where we're usually doing a higher dose vitamin C, which is in cancer it's oxidative, so it can help with cancers, killing cancer cells.
That's like almost your pH, right? Like it balances you. Is that sort of partly?
It's more about creating hydrogen peroxide within the system, and then if someone's getting sick. You've experienced some of the IVs when you're feeling a bit run down. So some higher dose of vitamin C. We add some things like zinc and selenium that are really good for immune system. I do a lot of acupuncture. I really enjoy acupuncture. Get really good results with especially things like hormonal imbalance, menopause. So we see a lot of hormone complaints, a lot of digestive issues. I like working supportive cancer care, and then I'm getting trained in regenerative injection techniques like prolotherapy and platelet.
Oh yeah, I've heard of that. A buddy of mine's dad does that.
Yeah,
and that's for like joints and stuff, isn't it?
Typically joint pain and injury. Yeah,
injuries. Yeah. Interesting. And that's using like a sugar solution? I think there's different solutions you can use.
Yeah, there's a dextrose solution, and then the platelet-rich plasma. You're using your own blood. And you spin it, and then you're extracting.
So you pull it out, spin it, and then put it back in to the joint.
Yeah, and that provides a lot of growth factors. It's an immune reaction, so people see a lot of good healing, a lot of pain improvement in pain as well.
As opposed to like a cortisol shot where. They can be dangerous, I think, too much, or like it can impair your limb movement and stuff.
There's a time and a place for them for sure, but it can degrade tissue, so it's not necessarily healing by any sense. It's more pain relief. But there's an expiration on the amount that you can do that without damaging tissue.
So it's not if, it's when sort of it'll cause damage. Yeah, so you want to be careful there for sure. Which, I mean, you hear the stories, right? I mean, sir, with everything there's issues, right? Or can be, but
yeah, absolutely.
Interesting. So you acupuncture as well.
Yeah.
So you're trained as an acupuncturist.
Yeah.
And naturopath, which obviously covers a wide variety of things. Awesome. Did that answer your question?
Yeah. I have another question.
Yeah, please.
Would you say that IV treatments are more beneficial than taking a multivitamin?
I think that taking a multivitamin, you're just hitting your recommended daily values on a bunch of different things. So I don't typically just give people a multivitamin. Usually it's more targeted. Normally we're talking a lot about food, getting those vitamins from your food. I think for me, IV therapy is a great boost. I like giving myself an IV once a month or so, but there's things to be done on the daily basis, like foundational things in terms of sleep and diet, stress management, that are going to go further than just doing an IV therapy. But IV therapy definitely has its place, but it's just one piece of the puzzle. It's never a standalone treatment for me. Yeah.
And a multivitamin, I hope everyone heard. What was your question again? Would you do it over a multi? Just I wasn't sure if they could hear, but would you choose IV over a multivitamin? So my understanding is a multivitamin is sort of a maintenance thing to help with maybe the lack of vegetables and stuff, which none of us get enough of. I know I don't. And IV would be more of sort of you could do it maintenance like once a month or something, but more in an emergency situation too sometimes, right?
Yeah, I wouldn't say emergency.
Not
I'd
emergency,
say
but when you're depleted.
As a boost. And when I graduated, I was really depleted. I was doing them once a week, and that definitely gave me a huge boost in energy, helped me recover more quickly. But exercising, being outside, managing stress, eating really well, focusing on my sleep. I think I probably would have had to do IVs for months and months and months if I weren't taking care of some of the foundational parts of my health as well.
Yeah, all those things that slip.
Yeah. It's easy to come in for an IV, and if people need that accountability and the time to talk with me, I definitely encourage it. But it's what you do on your own time that is really going to take your healing to the next level.
For sure. And there's different IVs, right? Like you have one that's just sort of a general, and then like there's an immune boost one and stuff and different.
Yeah. The high dose vitamin C especially is the most unique, and they're actually using that in hospitals now for
cancer patients.
Not for cancer, to prevent sepsis, so systemic infection. So that's it's becoming.
Is that sort of because all the issues they had in hospitals with infections and the
I'm not
superbugs
sure how they figured that out, but I just read a research article on it, and one of my friends who's a medical doctor, he actually brought it to my attention.
Yeah.
Yeah.
Huh, that's interesting.
Yeah.
They're stealing your glory.
As long as people are getting good treatment.
Fair enough. Yeah, it's about the people.
Yeah.
Clients first, right?
Yeah.
Awesome. And did you get them up with any other questions there, camera girl?
Good questions.
She's going to have to get on camera here. She interviewed me once. That was a long time ago. No? Okay. Moving on. Nobody has to see me. We'll get you in another time. Wait, maybe we should interview her one day.
Yeah.
Actually, that when we always ask at the end for suggestions who to interview. Sally and Go or whatever. She's like my Cutco, my gift girl.
Okay.
And I went to high school with her. She suggested that we interview Tanya.
Nice. Yeah.
We haven't done it yet though. So these questions are just a little more about you and sort of for fun. This one's different. You're a new addition to the crayon box. What color would you be and why? I guess that's out there.
It'd be a combination of the personality test, a blue-green.
A blue-green mix?
Yeah.
So that'd be like a purple.
No, I'm thinking more like...
blue and green mix is purple.
Okay, I can handle that.
Blue and green mix. Well, what would you think it would be? You go ahead.
I guess I just want something that represents nature.
There you go.
Yeah.
So blue, green. Yeah. That's blue sky, green stuff.
Yeah.
Green trees. What is your favorite 90s jam?
90s jam. So I was really into Weezer in the 90s. Our Lady Peace. And Bone Thugs and Harmony.
Oh, there we go. Yeah. Weezer's okay, I think, too. Bone Thugs. They got such a good beat, right? Like, with some bass, but Tanya hates rap. Cool. Bone Thugs and Weezer. We'll skip this question because you said you weren't really sure about it. What did you want to be when you were growing up? Did you have anything you wanted to be?
I wanted to be a doctor. Yeah,
so it was something that you knew.
Yeah. I looked up to my grandpa a lot, and thought he was the bee's knees for sure, and
awesome.
So it was always on the radar, but I wanted to. He was a pilot as well and an anesthesiologist, so he would.
Oh, really?
He would fly to rural areas and help with surgery. So he was
crazy. Back in the day when they did surgeries in rural areas, probably not as common now, I would think. Huh, cool. So I always wanted to be a doctor. People ask me that question. I'm like, I don't know what I wanted to be. I still don't know what I want to be when I grow up. I gotta grow up first, I guess. Is there anything I should have asked you, but I didn't ask you?
I don't think so. I feel like we've covered
hit the nail on the head. I know who you're gonna say though, but you can give as many as you want for recommendations. Who would you recommend I interview next?
I'd recommend Dr. Ian Harrington, one of my best friends, and chiropractor at Yellow Cedar Integrative Wellness. We're doing a lot of co-management of patients. So especially with low back pain, neck pain, they go see him, get a good treatment, and then often come see me for acupuncture and making sure they're sleeping well, their diet is right. Just we're creating the foundations for healing and optimal health.
Awesome. I met him. Is he into doing it?
Oh, yeah.
I've assumed you've mentioned it to him.
Yeah.
He's all over it?
Yeah. I don't know about all over it. But...
He's a little nervous, right? You didn't seem too nervous. That being said, just because, I always try to eat pretty clean, but sugar, but then you eat it and then you feel like crap and you're like, why? What would you recommend for like a sort of all-around diet for someone without prescribing or saying with a deficiency, but what would you recommend people eat?
Yeah, no, I get that question a lot, and I always say, depends on the person, and we're all unique and individual, but broadly it's eating a whole food diet, so the less processed, the better.
Yeah, for sure.
Lots of variety in colors. So you wanna eat the rainbow.
So lots of vegetables.
Lots of vegetables, yeah, and you know, good plant protein and healthy fats. And I eat meat. I vote with my dollar in meat and try and get grass fed.
Oh yeah, which is hard and expensive, but
it is hard and expensive. But for me, it's worth it.
Yeah.
And,
we get organic cow and pig, right? But chicken and stuff, it's hard.
Yeah. So and eating in a calm state and eat with friends and family and bring back the celebration of food, not just mechanically eating to do it. Enjoy it.
Right.
Yeah.
Enjoy it, but don't overdo it, and vegetables and stuff.
Yeah.
And yeah, I agree too. Healthy fats, like what do you use? Healthy fat, coconut oil, peanut butter.
Yeah, I stay away from peanut butter
Nuts,
typically. Not nuts in general, but peanuts are kind of the if there was an award,
arsenic.
They're aflatoxin is the thing in peanuts maybe, but
so cashew or something.
They degrade easily. Maybe. Yeah, I really like almond butter, cashew butter.
Almond butter's good.
Pumpkin seeds are really great. Other healthy fats. Sardines are really good. They're
not bad.
They're not bad, but they are probably the cleanest of all the fish.
Really? For healthy fat?
Yeah, they're so small. And,
so krill oil isn't a sardine, but krill oil sort of fall into that?
Yeah.
Yeah. That's what I take as a supplement usually.
Yeah.
Actually, I've been trying hemp oil lately, but...
Okay. Yeah, hemp oil probably won't be as good for omega-3s, but still a nice oil. Yeah.
So the biggest thing I can take away there is more vegetables, which my mom would always tell me I'm so bad at eating vegetables.
Yeah, whole foods, I'd say.
Whole foods. But more vegetables is always a goal, I think.
Less processed.
Less processed. Yeah, totally. Awesome. Well, thank you, sir.
Yeah, thank you.
Thanks everyone. Whoever's watching, was anyone watching? Oh, perfect.
Matt's watching again.
Oh, Matt. Get to work, Matt. He needs to get to work.
He's in the office?
No, he's